Medication side effects are potentially a way for an individual for a doctor to choose medications for his patients, so that there are certainly some good side effects of medications that we want. For example, uh, medications that lower blood pressure almost always have a secondary uh, effect. Whether you call it a side effect or a benefit is another question. So for people who take, say, beta blockers for high blood pressure, beta blockers were the original class of anti-anxiety medications. So if you have someone who has blood pressure problems and they have anxiety, well, beta blockers may not be a bad choice. There's some calcium channel blockers that lower heart rate. And so you want to choose, for someone who has rapid heartbeat to begin with and they have blood pressure, you may want to choose a calcium channel blocker that lowers heart rate as well. So there's that benefit that you want to make sure that if a medication has side effects that you do want, you want to make sure that you pick a medication from that class, which would take two medications and reduce them into one. One medicine is giving you the benefit of two. That's a good thing. The other side of that equation is that there are also medications that you definitely do not want, and that they have side effects that are highly problematic for your patients. And that could be, say, antihistamines in someone who's older and predisposed to having dementia, and then all of a sudden you gave them an antihistamine and they're in the hospital because they can no longer manage their own affairs. Or people who have dry mouth to begin with, and you give them something that has dry mouth as a side effect. The more complicated issues come up when a medication interferes with the metabolism of another medication, and then the combination can lead to the buildup of those medications over time. And usually this one you can tell because the first couple of days that people took a medicine, there were no problems, they were in fact better. But by the third or the fourth day, you started to have the side effects because, well, it was stopping the metabolism of the first medication. So the first medication built up, and by the third or fourth day, it started to give you side effects. So those things are always important to keep in mind. It's also important to keep in mind that some medications and some supplements actually make other medications work well. One of those would be what we use in treating people with dormant viral infections, and that would be taking a medicine earlier in the day or a supplement earlier in the day that increases the activity of the virus that you're targeting. And so that you can use that combination, the effect of the first set of supplements on the virus, and then how they make the response to the antiviral medications much more pronounced and lead to actual clinical remission of these viral infections.